Good afternoon, ladies and gentlemen, members of the Board of Directors of North Wellington Healthcare and Minister of Health for the Province of Ontario, Sylvia Jones, MPP for Perth-Wellington, Matthew Rae. My name is Dr. Gavin Smalago. I'm the lead physician for the Minto-Mapleton Family Health Organization. The lands we know today as the town of Minto, on which this medical center sits, have been home to Indigenous peoples since time immemorial. We acknowledge that we are on the treaty lands and traditional territory of the Anishinaabe and Haudenosaunee peoples. These peoples uphold their treaty rights within our jurisdiction. We are grateful to have the opportunity as sentient beings of Turtle Island to share and respect Mother Earth, and are committed to building constructive and cooperative relationships with Indigenous nations. Minister Jones, we are positively delighted that you were able to make it to Palmerston to celebrate our success story in the recruitment of a new physician to our healthcare team through the Practice Ready Ontario program. Dr. Nara Luzinga joins a group of 8 family physicians and allied health professionals from our Minto-Mapleton family health team, who together serve a large rural population extending from Clifford in the north to Drayton in the south and beyond. We are grateful to our recruitment team and our liaison at the Touchstone Institute, whose efforts will allow us to provide a comprehensive, patient-focused approach to healthcare for the people in our region. Dr. Luzinga will assist us in meeting the healthcare needs of the growing and aging population in this medically underserviced area, and is part of the investment in frontline and long-term care that we will be seeing in this area in the next couple of years. So thank you for joining us in farm country, and maybe if the stars line up, we'll see you next year at the ribbon cutting ceremony for our new MRI machine. Mr. Jones?
Thank you very much, and I hope so. So good afternoon, everyone. It is indeed great to be here at the Minto-Mapleton Family Health Team to share one more way our government has been connecting you to primary care close to home. It's great to be joined by your local MPP, Matt Rae, who has been a constant champion for your community at Queen's Park and in the larger Ontario narrative of building a connected and convenient healthcare system across Ontario. On behalf of Premier Ford and our entire government, I want to thank the team at Minto-Mapleton Family Health Team for hosting us today and for everything you do to provide exceptional care to families in your community. Under the leadership of Premier Ford, our government has been making record investments in healthcare to make it faster and easier to access the care you need when you need it, no matter where you live. We are strengthening all aspects of our healthcare system to provide more people with the right care in the right place, whether that be at your local hospital, community pharmacist, or primary care provider. And we are starting to see the results. Ontario has the shortest surgical wait times in all of Canada and is leading Canada with 90% of people connected to a primary care provider. We are getting shovels in the ground for over 50 hospital developments that will add over 3,000 new hospital beds. And we are adding 49 new MRI machines, including one right here at North Wellington Healthcare. We're growing and supporting our healthcare workforce, adding a record 100,000 new nurses and 15,000 new physicians. And we continue to expand the scope of practice for Ontario's highly skilled nurses, nurse practitioners, midwives, and pharmacists, many of whom work together as part of interprofessional primary care teams like the Minto-Mapleton Family Health Team to deliver more connected and convenient care. Our government is also working to close the gap for the people in Ontario not currently connected to a primary care provider, ensuring the remaining 10% of Ontarians who want a primary care provider can connect to one. We're listening to our family physicians, adding and expanding interprofessional primary care teams to connect to an additional 600,000 people across Ontario to primary care, including, again, here at Minto-Mapleton Family Health Team. An exciting announcement MPP Rae was able to make in February, connecting 1,600 more people in your community to care. We have added hundreds of new medical residency positions specifically for family physicians. And we are opening 2 new medical schools as part of the largest expansion in medical school education in over a decade. Our government is also expanding the Learn and Stay grant program to cover tuition for medical school students who commit to practicing family medicine. This expansion will train 1,360 new family physicians, connecting an additional 1.3 million people to primary care. We are proud of the progress we have been able to make, and we know there is more that can be done to continue to close the gap for the people in Ontario not currently connected to a primary care practitioner. And our government is taking that action. That's why today I am excited to announce our government has been able to add 100 new family physicians in rural and northern communities through the Practice Ready Ontario program. This program breaks down barriers for highly skilled, internationally educated doctors with experience practicing family medicine by removing the requirement to complete unnecessary re-education programs in exchange for a return of service in a rural or northern community. Each physician completes a 6 weeks assessment where they are trained in all aspects of family medicine to demonstrate that they have the skills needed to practice in rural Ontario. 28 family doctors have completed the Practice Ready Ontario program and are connecting more people in communities like right here in Palmerston, Trent Hills, Sudbury, and Gore Bay to primary care. It is anticipated the full 100 family doctors will complete their training in 2025. Based on the average attachment rates, this means an additional 120,000 people will be connected to primary care close to home. The Practice Ready Ontario program is one more way our government has been connecting you to the care you need close to home. Thank you again to everyone here at the Minto-Mapleton Family Health Team and all the incredible healthcare workers in your community for the tremendous care and support you provide families. I'd now like to invite MPP Rae to share a few words. Stay well, everyone.
Good afternoon, everyone. It's wonderful to be here for this very exciting announcement by Minister Jones. Thank you for coming to my hometown. As you found out, as soon as when you walked in the door, I pointed out I was born in the hospital literally across the parking lot. And then everyone went into telling them how they knew either my friends or my parents or some other connection. So really appreciate that sort of homecoming that Minto-Mapleton obviously brings every time I have the pleasure of visiting with them. I just want to recognize, obviously, Mayor Turton is in the back there as well, and it's great to see the support from the town, their key partner, especially in the Harriston Nurse Practitioner Clinic that I had the pleasure of attending the opening, which the Minister was help funded through that expansion that you referred to earlier, which was really well received. And I always get the question, why is this expansion important? Well, I met an individual at that expansion in Harriston, and this individual did not have access to primary care for 15 years. Because of the investments our government has been making in that expansion across Ontario, 78 new projects, most recently the one in Minto-Mapleton, that individual is able to get treatment for any skin lesions they may have or anything else that they may need to see a primary care physician and to get that care close to home. And we're really building on that with this announcement today, with Minister Jones announcing obviously a new doctor locally in Minto-Mapleton, but 100 across the province being there to support our rural and northern communities, providing primary care closer to home. And as Minister Jones mentioned, we'll continue to make those investments year over year, whether it's the Learn and Stay grant, whether it's the Practice Ready program, or whether it is continuing to expand primary care access with our family physicians, our nurse practitioners, as well, ensuring that anyone who wants to access a primary care provider in the province of Ontario can do so. And with that, I will turn it over to Dr. Chu.
I would like to start off today by thanking the Minister of Health, Sylvia Jones, as well as MPP Matthew Rae, for spending their time today in our community and local health care center. I think I speak for all of us with the Minto-Mapleton Family Health Organization and Family Health team by saying that we are grateful for the opportunity to participate in today's events. The world is a vastly different place post-COVID, and quite expectedly, that difference has been felt most in the healthcare sector. In particular, recruitment and retention of healthcare workers has been a challenge faced by all communities, including Minto-Mapleton. The ability to recruit new primary care providers to our area has not been easy, and as a result, we have had to think outside the box from traditional recruitment means. Almost 1 year ago, our family health organization submitted an application to the Practice Ready Ontario program, and we have been fortunate enough to match with an internationally trained family physician who will be joining our community and provide local primary care. I am very excited to have Dr. Nara Lazinga join our office and look forward to the opportunity to work with her for the next 3 years and hopefully even more years beyond that. I've only worked with Nara so far for a few weeks, but I already know that she's going to make a fantastic addition to our team. Thank you for your time, and with that, I would like to introduce Dr. Nara Lazinga.
Okay, my name is Nara, as Patricia stated, and I'm one of the Practice Ready Ontario candidates. I am truly excited about the incredible opportunity that Practice Ready Ontario has created for international medical graduates, including myself, to become family physician in Ontario. This program represents a significant milestone in my journey toward practicing medicine in Canada, and I am deeply grateful for the chance to contribute to the healthcare system of this country. I have always believed that Canada is not just a country, but a home where dreams can flourish for those who are committed to seizing the opportunity it provides. I am particularly inspired by the diversity and inclusivity of the Minto-Mapleton Family Health Organization. The unwavering support I have received from the Minto Rural Health Center team has been invaluable. I would like to take this opportunity to extend my heartfelt thanks to the Ministry of Health for their dedication and support for the Practice Ready Ontario program. Their commitment to helping international medical graduates integrate into the healthcare system has been instrumental in making this dream a reality. As an immigrant physician, I am honored to bring my skills, experience, and passion for the medicine for this diverse community. Thank you for welcoming me with open arms and for allowing me to be part of this amazing journey.
It is now time for questions from the media. Each member of the media will have an opportunity for one question and one follow-up. Please state your name and your outlet before your first question.
Hi, I'm Cameron Mahler with CBC News Kitchener-Waterloo. I just wanted this question's for Minister Jones. This is a welcome announcement for people here in rural Ontario, but what do you say to people in nearby communities, including Durham, where they've seen their hospital services cut and they're worried about not being able to access emergency health care in their community?
Well, what I hope that they are seeing is a government that's committed to ensuring that all aspects of our healthcare system continue to have support from the provincial government. You know, we talk about the short, medium, and long-term goals. Of course, the practice ready assessment that we've talked about today is one of those more short-term goals that we can immediately ensure individuals who want to practice, live, and work in the province of Ontario have the opportunity to do so quickly. In terms of the longer-term planning that is going on, I referenced in my remarks that 2 new medical schools in the province of Ontario, in Brampton and in Vaughan, and we are very much focused when we are training those students, those new individuals, to focus on family medicine. The Vaughan York Medical School, 60% of those students will focus on primary care, family medicine. We have a pilot project that's happening right now. It's in its second year with Lake Ridge Health and Queen's Medical School, where again, students who know that they want to practice in family medicine start in year one and incorporate that. The interest and uptake in that pilot has been very, very positive. Obviously, many more students interested in that pathway than we have positions for them. And it just speaks to people want to be in Ontario. They want to be able to practice in Ontario. Again, I referenced in my remarks, a year ago, Ontario was sitting at around 88% of individuals were attached to a primary care practitioner. As of data that came out yesterday, we're now in Ontario sitting at over 90%. And I make those comparisons when we look across Canada at other jurisdictions like BC that is sitting in low 80s percentage rate. So we've made progress, but we have a lot more things that we are working on, and we are seeing that as we bring forward these policies and initiatives and programs, it's making an impact.
A follow-up for you. The heart hubs that are meant to replace CTS locations are supposed to be open by the end of March. Does that mean that the treatment beds at those sites will also be fully operational by then?
So we are actually assessing the Heart Hub applications currently. There was a lot of interest from not only our municipal partners, municipal leaders like the City of Guelph, who say that they are embracing the Heart Hub model, where you have access to not only just ensuring and enabling drug use, but if you need help with social services, if you need help with healthcare, if you need help with mental health and addictions treatment pathways and access to supportive housing, that's ultimately what the Heart Hub model is about. It's bringing together many different organizations that often already work in community, but putting them together so that they can assist the whole person. We have to do better. We have to give people hope that there is a pathway out of addictions, and part of that is absolutely the model that we are moving forward with. As I said, the assessments are happening right now, and we fully anticipate being able to make announcements and deciding where those heart hubs are first going to be placed in Ontario.
Good afternoon, Minister Jones. My name is George York with the Wellington Advertiser. I was just wondering if you see a time in the near future where there is no longer a gap of that 10%.
Absolutely. So we have made a commitment. We've brought in Dr. Jane Philpott to lead what we've already started. MPP Rae referenced 78 expansions or new primary care practitioners were announced in February of this year. The Minto-Mapleton is one example of that expansion, nurse practitioner-led clinic as well. So we have tasked Dr. Philpott to, in the next 5 years, ensure that every Ontario resident who wants a primary care practitioner gets one. And I'm really excited that we have not only focused on making sure that we have the training pathways, but we also have the capital side of it. It's an all-of-government approach, and I very much look forward to making many more announcements in the months and years to come on the expansions.
That concludes our media event for today. Thank you, everyone. We're now going to take a group photo at the front.